new coronavirus was discovered just over a month ago. And there's a lot that we don't know. We don't know how quickly it's spreading, how wide, how far.
Indonesia has reported its biggest daily jump in COVID-19 cases.
Safe distancing measures have begun in Vietnam. People have been told to stay at home for 15 days.
India's 78,761 new cases in a single day surpassed the previous record, 77,299, set by the United States in mid-July.
Many people living with HIV don't pick up the medication near their home. They register in an OPC in a different province, and lockdown made it impossible for them to pick up their medication.
Transportations become one of the problems for the TB community, especially for the TB patients, because they have to go almost every day to the health facilities. They fear to get infected by COVID-19 if they use the public transportations, or they have to spend more money if they use more private transportation such as taxis.
The discrimination and stigma towards high-risk group, especially the transgender people, was very, very acute and intense. But as a result of them, a lot of transgender people lost their rented house. Much more has happened. Much more suicide has happened. Much more denial of injustice has happened. But we don't have a data.
Yes, it's not so easy. It's quite difficult with virtual when it's a training or meeting for 10 hours or 20 hours or 30 hours needed. It takes a focus, but it's quite difficult with virtual. But we don't have any choices. We have to continue our works because we need to support people, because people need us in the field.
But we are not number. We are human beings. We having life, and we have our family, our responsibility, which we want to perform. So that needs to be addressed in mind of society, in government, to making any decision without face and without voice.
Responding to pandemics like COVID-19 is exactly what the Global Fund does. And it's why world leaders created the Global Fund in 2002. With nearly 20 years' experience in fighting HIV, TB and malaria in more than 155 countries, we're the world's leading organisation supporting testing, contact tracing, treatment for deadly infectious diseases, and procuring and distributing massive amounts of health supplies in low and middle income countries.
As the world's trusted, proven partnership fighting major infectious diseases at scale around the world, the Global Fund is playing a critical role in the global response to COVID-19 in the poorest and most vulnerable countries. While rich countries have increased government spending by $10 trillion and counting, the health and other funding opportunities for poor and vulnerable countries are limited. The Global Fund has already provided more than $700 million to help countries fight COVID-19. But our emergency response fund will run out of money by the end of September.
I'm Daksha Patel. I'm from India. I'm living with HIV since 1997, and I'm chair of National Coalition of People Living with HIV here, NCPI+. And I'm also part of Gujarat State Network of People Living with HIV. We are covering MSM, TG, sex worker, IDU, and very important youth living with HIV also working with us. And women and children are also most priority in our organization agenda.
Hello, namaste. My name is Abhina Ahir. I'm a transgender activist from India. I work with India HIV/AIDS Alliance as an associate director on gender, sexuality and rights, and I'm also a health champion of India Working Group, which is associated with Global Fund Advocacy Network. India HIV/AIDS Alliance is working with high-risk groups. It's working with 5 major high-risk groups. It works with women in sex work. It works with people who get drugs. It works with men who have sex with men, people living with HIV, and also we work with young people. Countries like India, we were actually putting up a huge response towards MSM and transgenders. Global Fund actually in 2010 for the first time creating this huge program to ensuring that no one is leaving behind.
Hello, my name is Oanh Khuất Hai Oanh. I am the Executive Director of the Center for Supporting Community Development Initiative. It's a local NGOs in Vietnam. We work with the marginalized and vulnerable population to improve their quality of life and social inclusions. So at SCDI, we employ 3 different approaches. Number one is community empowerment. So we support the community to organize into the community-based organization and network. Second approach is creating enabling environment that including reduce stigma and discrimination and working on policy advocacy to make the policy inclusive and supportive for the community that are marginalized and vulnerable. And the third approach is to work on the service delivery model, like how to deliver services, particular services to certain population or community to make sure that they have access to service and the service to be effective.
My full name is Merinda Sebayang. People usually call me May. I'm from Jakarta. I live in Jakarta, Indonesia. I work as a chair of the Positive Indonesia Network, the national network of people living with HIV in our country. And I'm also a member of country coordinating mechanism for the HIV program supported by the Global Fund funding. And also I'm the head of technical working group of CCM in Indonesia. I have also become a part of the community delegation of Stop TB Partnership. Our organization is mostly working with the people living with HIV and also key population who infected by the HIV. So in Indonesia, the term of key population is divided by 4 subpopulations, which is female sex worker, transgender, people who injecting drugs, and also men who have sex with men community.
My name is Daniel Marguari from Spiritia Foundation in Indonesia. We are working for HIV throughout Indonesia, especially to improve the quality of life for people living with HIV and AIDS in Indonesia. We have been working for 25 years, from the beginning as a peer HIV and affected people peer support groups, through this peer support system and mechanism, working together with all those peer support groups in Indonesia and catalyst group of PLHIVs. Then we facilitate to empower those PLHIVs in Indonesia. Spiritia Foundation since 2016 become a principal recipient of Global Fund for HIV works and managing a big program throughout Indonesia for prevention and quality of life of PLHIV in Indonesia, and we're managing with the total grant around $55 million for 5 years.
COVID-19 impact a lot. It is really affected their life is affected a lot with COVID-19. It's directly or indirectly impact on their families, their day-to-day life, their nutrition, their responsibility of entire family. So and even so much of impact on mental health as well, because people are if the income is not in home, so how they will manage their day-to-day expenses or day-to-day responsibility. Basically around families, they don't have big saving in their on their hand, so it is really very big challenge for to survive themselves without during this pandemic. Due to immediate lockdown, the people went back to their native place, most of the migrant worker or their interstate migration. So they had only very limited doses of their antiretroviral medicine, and they don't had a time or not had a chance to visit their regular ART center.
The social and economic impact of COVID-19 on the population that we care about are really paramount. So the people living with HIV, sex worker, people who use drugs, people who are vulnerable to TB, people who are vulnerable to malaria, most of them are working in informal sector. They don't have employment insurance. So they live hand to mouth. When they stop working, they stop eating. In addition to that, lockdown make travel very difficult. So even people with symptoms of TB, for example, because there's no public transport, the transportation was shut down between cities from different places. So even if people have a symptom, it's extremely difficult for them to get to the services they need for screening and treatment.
I think it's clear, because of the social restrictions, we got pushed to stay at home, and also some of the health services changed their role, become COVID-19 facilities. Nowadays, I also heard that most of the HIV facilities they changed their role, become the COVID-19 facilities. They changed the time of services. Usually people can come every day to the facilities, but now the health facilities make a new policy that maybe community can only come once a week, and they already decided which day that you have to come, because they want to also to prevent the community get infected by COVID-19. Biggest NGO in our country, they did a survey, and around 36% of TB patients experience transportation problems to get health services, and also 23% stated that they did not get TB treatment because of COVID. So I think the situation, maybe the health facilities still open and still provide the services, but from the patient side, it's difficult for them to access the treatment or access to the health facilities.
The Global Fund reacted decisively to the emergence of COVID-19, and we're playing a critical role in the COVID-19 response in the world's poorest and most vulnerable communities. Together with partners, we are strengthening systems for health so that they can test, track and treat for the virus, and also be prepared to roll out vaccines once they become available. We're procuring and distributing COVID-19 diagnostics and therapies as they become available. We're protecting frontline health workers with personal protective equipment, and we're helping adapt life-saving HIV, TB and malaria programs so that they can safely continue. In early March 2020, the Global Fund introduced new grant flexibilities to enable countries to use savings and reprogramming from existing grants to rapidly adapt HIV, TB and malaria programs, to purchase protective equipment, to procure COVID-19 diagnostics and medical supplies, and also to strengthen the immediate response to the pandemic. In April, the Global Fund launched the COVID-19 response mechanism with an initial capacity of an additional 500 million. The Global Fund is a founding partner of the ACT Accelerator, the world's largest and most effective coalition to develop and equitably distribute COVID-19 protective equipment, tests, treatments and vaccines worldwide. The Global Fund is co-leading on two of the ACT Accelerator's 4 pillars, diagnostics and strengthening health systems, and we're also supporting the procurement and distribution of therapeutics.
The Global Fund is also unique in that civil society and communities affected by the 3 diseases are a core part of the Global Fund partnership. Vibrant and robust civil society and community mobilization and advocacy campaigns were crucial to the success of the $14 billion raised during the sixth replenishment in 2019, the largest sum ever raised by the Global Fund and the largest international fundraising in global health ever.
As a principal recipient, Spiritia have many sub-recipients working in provincial and regional, also sub-recipients in the district level. Also, we call as implementing unit for PLHIV organization or group who working to empower other PLHIVs in their place. So we support them with a grant, then with the technical assistance to the SR directly, and for SR right now, we create many initiatives to make this HIV work can continue, because people still need to get the information. People need the access for testing, to get the treatment, and many needs still need to fulfill. With that situation, then we decide we have to continue to adapt with a COVID situation. Then we provide them with the masker to make their work, hand sanitizer, and to provide guidance how to work with the protocol. We call a COVID protocol, with the simple guidance to make them work in the field when they meet the people, how to keep a distance, and other guidance technically to reduce the risk for all those people who's working in the field to get the infected by COVID, or maybe infect others.
The resources which was provided by the Global Fund was extremely crucial, because with the help of Global Fund resources, we managed to provide services to the clients by providing their home-based ARV medication. We did provide a support on gender-based violence. There was a support which was provided through the mental health counseling for the high-risk groups like me. And at the same time, we also provided, we managed to link with various government department, other facilities to provide a dry ration for various communities during this period. And also there are so many people who were provided, especially the people who are migrated and who did not have access to ARV medication. The ARV medications was pushed down. We did manage to provide a home-based ARV medication PPEs to the frontline workers with the Global Fund money, and that way we have managed to keep our HIV response going during the COVID-19 period, and especially we serve high-risk communities and we serve people who are living with HIV.
Civil society in Vietnam got the funding from the Global Fund 10 years ago. So for the last 10 years, we have a line of funding from the Global Fund directly to community and civil society, and that funding enable us to build a community system. We start to work on malaria 2 years ago, and we built a network of community malaria action teams. We have over 60 teams in the malaria endemic area in Vietnam. The malaria in Vietnam are concentrated mostly to the people who go to the forest, who sleep in the forest, go to the forest. Most of the forests in Vietnam are protected forests. So people who go into the forest are in fact doing illegal activity. So they try to avoid being identified by authority. Our community worker reach out to them to provide malaria services and commodity like hammock net, and refer people or bring people for malaria testing, and support treatment if they have malaria. But at the same time, we start to mobilize also food to help the poor family, the poor family of indigenous people who live near forest. So they have food to eat, they don't need to go to the forest to look for food.
So the support from the Global Fund actually for Indonesia is already started from 2002. During this pandemic, because India being locked down, China being locked down, so we have a problem or difficulties to get treatment from India and China. So this is a very tough situation, but that's the first thing that being our major concern. It's not only for our organization, but also for other stakeholders who works on HIV issues. And how we ensure that the treatment is available at the health facilities. We use the virtual platform to coordinate with the Ministry of Health and also with the procurement system for the health commodities. So every month we have a coordinations regarding about this stock, and if stock out happens, usually we will contact our local focal points and say to them that they have to build a strong coordination with the district health office. So we use the mechanism for monitoring of availability of the treatment.
Basically, before COVID-19, NCPA Plus working since 2012, and our main motto is to improve quality of life of people living with HIV. So, surrounding this vision, we are working with a community member in the field level with collaboration with the state and district level networks. During COVID-19, all of a sudden, situation was changed in everywhere. So the immediate what NCPA Plus does in lockdown or in COVID pandemic, we started a communication with the community members in our WhatsApp group, even our phone calls, and like it is like a war room. We immediately started with we work with the Status Control Society closely, and community-based drug dispensation, community-based drug refilling services we initiated, like at the district level network, at the state level network offices, we utilize as to provide ART medicine, and the medicine transported to main ART center to the nearby community member. Overall concept of this process, we focused on uninterrupted treatment facility to each and every community member.
If the world's poorest and most vulnerable countries and communities don't receive urgent and adequate support to fight COVID-19, deaths and infections from COVID-19 itself, but also from HIV, TB, and malaria could skyrocket. Deaths from COVID-19 in the first several months of 2020 have already exceeded total deaths from HIV and malaria. Recent modelling studies by WHO, UNAIDS, and Stop TB Partnership indicate deaths from the three epidemics could as much as double in the coming year as a knock-on impact of COVID-19, as health and community systems are overwhelmed, treatment and prevention programs disrupted, and resources are diverted. We simply cannot let this happen.
To achieve our 90-90-90 global goal and to achieve our target, the donor needs to be continue their investment in 3 diseases. This is the all community members we are expecting from the donor. If I want to say one key message to Global Fund, it needs to be continue, it needs to be strengthened, it needs to be sustained investment in the community member.
Every country spend billions US dollar for COVID. And I quite worry right now for the next few years that country will not have enough money to spend for other diseases like AIDS, TB, and malaria. It's become a barrier. It's become a serious how we can answering this, because if we want to change this epidemic, countries still need the money, and especially communities. It's become difficult. The work should continue. We cannot change this epidemic without communities' engagement. And especially when the country, government, they don't have enough money to spend for the ATM diseases. you know what will happen in the future.
To meet the needs really needed by those affected by TB, HIV, and also malaria. And please try to look and judge from their point of view, the community point of view, and try to walk from their shoes. And please don't decide what you think is right without ever asking what the community really needs.
This is the time when we have to demonstrate more engagement. This is the time when we have to show more commitment. And that more commitment will only be demonstrated if you and me work together and also ensure that is every money that you give it to us will be well spent. So please make sure that is you become part of the social change and support us not to leave anybody behind in this tragedy.
So my hope is that the Global Fund will be able to invest beyond direct and immediate intervention for HIV, TB, malaria. It has potential to do that because we are already there, we already reach people, we already know their needs, we are already connected to different systems that can assist them. So a little bit more investment from the Global Fund will help us not only to address HIV, TB, malaria, but also address other health needs to help to the country to achieve UHC, the UHC for the population that are currently being left behind. The universal health coverage can be realized for even those marginalized and vulnerable population.
Robust health systems are not only essential to ending HIV, TB, and malaria epidemics, they yield broader health outcomes, delivering health services in a sustainable, equitable, and effective way. Global Fund urgently needs $5 billion over the next 12 months to continue to fight COVID-19, protect health workers and systems for health, and defend progress against HIV, TB, and malaria programs in the countries where we invest.